Welcome, great to have you here as our first webinar in this series. So I'll be going through a little bit of information around the graduate certificate. The program is a 6-month program offered in semester 1 and then again in semester 2. And it's a program that is there specifically for dental therapists and oral health therapists who have graduated and been working for a couple of years. And it's a chance for you to be able to take those same skills and provide that care to adult patients. The program has a really flexible style that we offer face-to-face learning as well as a lot of online learning that you can do in your home clinic and on weekends or after clinic hours. The content will cover mainly oral health assessment, so examination and treatment planning of adults, providing restorative care and prevention for adult patients. Many of our students certainly find that they have had such a great supportive environment, both with other students and with the staff, and really having a small group, particularly during the face-to-face sessions, has been fantastic. And they've kept in contact during their time away that has really helped their learning. The learning outcomes of the program are that we provide information that allows you to undertake clinical exams on adult patients and also developing comprehensive treatment plans. Then you can provide the restorative care of simple direct tooth restoration for the adult patient, taking into account all of the different specialties, clinical disciplines, and the different medical disorders and medications that adults might be taking. And that will provide you all of the skills to be able to treat the adults. In terms of the curriculum, it actually has 2 courses of 6 units each in dental health science and clinical practice. However, as a student, this tends to come together as one subject called oral health science. In the dental and health science, we provide the scientific aspects of the program, and then clinical practice, of course, is the clinical component. So it's very much a blended learning approach with some theoretical online linked very closely to case-based learning. So we use a lot of scenarios, tutorials that are based on patient information that really helps you apply a lot of your learning. So we have a range of class meetings, tutorials, interactive online learning modules, workshops, simulated and then clinical practice sessions in your own clinic during the distance learning weeks. Many of the students found that it was fantastic to have that mix of face-to-face with the online learning, and particularly with their clinical mentoring with the mentor that they have in their home clinic. There's also lots of access to a range of different lecturers and tutors during your face-to-face sessions, and each of these are really keen to provide that same support either through email or through phone calls. Previous students have really enjoyed the variety of teaching and the different cases that they've had, where it's really been a great chance to have really quite comprehensive discussions and really exploring all of the different ideas that the other practitioners have. So in oral health science, we really look at an interdisciplinary approach to the ageing dentition. What are all of the different factors that influence the care for an adult patient? We look at the principles of examination, diagnosis and treatment planning for the adult that also incorporates perio and pros considerations. We look at how you need to clinically assess the adult patients, what are the different risk factors that might impact on the different treatment planning and management. Of course, we have a cariology and a root caries update and look at the different ways that you can actually manage root caries. This also incorporates the different tooth wear aspects that are important as part of the different restorative techniques that you need to apply for the adult patient. So the structure of the program is actually over an 18-week period. So we start in the first 2 weeks with face-to-face intensive sessions We do open up online material for the first 2 weeks prior to the week 1 so that you can do quite a bit of pre-reading beforehand. This really maximises the time that you've got during face-to-face and to be able to assist some of those discussions. During weeks 3 to 6, you go back to your home clinic and we ask you to do additional reading from the online learning, but also to observe your clinic mentor in their clinical skills for half a day a week. That's an opportunity to really look at what are some of the differences that they might provide for care of an adult compared to what you do as part of your scope of practice. That then gives an opportunity to really discuss those different aspects with your mentor and look at some of the different learning materials and how that varies. You come back for week 7 for a 1-week intensive face-to-face, where again you get more theoretical, more simulation clinic, and a lot of the tutorials with some of the different academic staff. You then go back to your home clinic for 8 weeks, from week 8 to week 15, where we ask that for 2 days a week, you work on adult patients under the supervision of your clinic mentor. That can vary in how that works. That can be 2 straight days, or it can be throughout your clinical weeks. It depends on how it works within your clinic. You then come back for week 16, which is a review week, and we spend quite a bit of time during this week exploring different patient cases. We want to really look at all of the different options or thoughts that each of the different students and tutors have, because as you know, dentistry is not a simple yes or no or black and white. There's certainly many different ways that you can manage different adult patients. So this week is a really important week just to explore all of the different ideas, particularly after your 8 weeks of clinical work. It's also a key part of preparing you for the assessment week, which is in week 18. So during week 17, you swap that week. Week 18, you come back and you have 3 days of assessment. But we do a lot of work trying to prepare you so that nothing is a surprise. So the clinic mentor, you have to have your own clinic mentor. That's someone that you work with that can provide support for your learning. So they would be there during your clinical practice weeks where they would need to look at the patients, if you've done an examination, to be able to look at it afterwards, to be able to talk through the treatment plan and to check your restorative work on the adult patient. So they're there to provide a lot of support for you. It's a little bit different to the tutoring relationship that you would have had when you were an undergraduate, because you are a qualified practitioner, but it's very much a collegiate approach to learning and utilising all of their information, their experience. So they will provide the oversight, assessment and feedback on your clinical sessions that then comes back to us as the university. We do like to incorporate a lot of self-reflection. We see that as really important in your learning, for you to be able to reflect on what you've learned and what skills you've achieved, knowledge that you have that can help you in future patients that you have as well. With the clinic mentors, many of them have tutored before or may have mentored before, but some might be new. And we do provide some training calibration to ensure that they have the skills and the knowledge to make them comfortable in this process. We have asked mentors to come for a day of training in Monday of week 2 of each of the programs. However, we will be exploring the use of a webinar, as we have many people that have to come from interstate. So that's something that we will confirm closer to the time. We do like to have ongoing contact between academic staff, students and clinical mentors, and we're available either by email or phone for any questions. The students feel as though one of the key aspects of the program was the work that they did in the clinic and the support that they had from their clinic mentor, and being able to actually undertake their clinical work in their place of employment. So their comfortable environment is patients that they may have seen for quite a long time for some of their hygiene work. It might be that it's some of the children that are now older and they can actually treat those for ongoing care. So it's been a really important part of the program. In terms of admission to the program, there are a few key aspects that you need to consider. You must be a registered dental or oral health therapist with a minimum of 2 years clinical experience. We only have 10 places per semester, and we feel that's really critical for the program, and certainly something that all of the previous graduates believe is a very positive part of the program. That it's a small group and you get lots of discussion as part of that. The application is initially through SATAC Grad Start, where you need to apply through there first. Then there is an additional university application, and that's available on Degree Finder on the university website. There is quite a range of information on there that can assist you in that university application process. You need to actually use your number from SATAC as part of that application process as well. So the first part is to apply to SATAC and then complete the additional university application. That also requires the development of a personal competency statement against 4 criteria. That information also is available on Degree Finder. You will need to have 2 independent referees who will fill in a referee report. That'll be an online report that they complete as well. You will need to provide a CV, and you will need to upload some documentation such as your university degree, your ARPA registration, and if applicable, your radiography licence. But again, have a look at the Degree Finder, work through the information. If you have any questions, please contact us. So some of the feedback from graduates that we've had through the programs is that they find that 55% of those graduates spend more than half of their work hours undertaking adult therapy. So some people have been concerned, is this something that's going to be relevant for me? But certainly they found that there's a number of patients that fall well within this scope. 70% have had a change in their salary since completing the program, which generally means that that's an increase in their salary. But most of all, the feedback has been that they just love the variety in the work that they do, that they see a number of adult patients during the day that fits well within their scope of practice with restorative care, that they've had a really great opportunity to work within the practices to actually optimise the care for everyone, and that the dentists have been really grateful at the opportunity at having the change in practitioners and expanding the different opportunities for their patients.
Brilliant. Thank you so much, Jenny, for providing the insight into the degree. So in terms of the core requirements of the degree, it's just key to remember that not only is there the standard university SATAC application, but there is that direct application that you need to access from our Degree Finder website. So the Degree Finder is the core resource where you find information about the degrees that we have on offer, and there'll be links in the entry requirements section there to access all the relevant paperwork that you need to complete for that one. As a reminder, if you do have any questions throughout the session, please pop them into the Q&A panel on the top left-hand side of your screen. Just give that on a click and type them in. We'll be addressing those questions very shortly. But before we do that, we actually have our special industry guest today, Tracy Hood. So Tracy will give you a little bit of a background about who she is, and where she's come from, and what she's doing now. So I'll hand over to you, Tracy.
Thanks, Harry. So I'm a South Australian trained dental therapist. I trained in the late 80s and graduated 1990. Spent my whole career working in the public sector, both here in South Australia and Western Australia, which has meant that I've provided dental therapy skills to clients under the age of 18, up until when I went back to study and completed a postgraduate course, and then now I see a mixed range of patients from 0 to, I think my eldest patient, 98. The reason I decided to move forward and take up the opportunity to change or extend the clients that I see was just saw a need. I'd been treating lots of younger patients for years. Their parents would say, oh, if only I could see you, I wouldn't have this problem about going to the dental clinic. So I thought when the opportunity came around, it was a perfect time to take that challenge. So I moved on, did the study, and since studying, I'm one of those people that spend about half of their time seeing adults and half the time seeing children. So I have a really varied day of clinic. So although I think in some days it's supposed to be I see children this day, adults another day, my ideal day is to see the blend of patients as they come through the door, and that's happening more and more. The skills that you use with your child patients certainly stand you in good stead to build really great relationships with adult patients. They appreciate often the explanations that we've taken for granted for years giving to children. They really appreciate that opportunity of being explained quite explicitly what you're doing and how you're doing it. And I think the rewards for us as clinicians is that it's a different group of people to have that, I suppose, clinical relationship with, see a need that they need fulfilling, and you're able to help them get through it. So that's probably the main reason why I chose the challenge. And the rewards, as I've said, are great, but the actual, I suppose, the group of people that you study with tend to become lifelong friends. You're in a very close relationship while you're studying, and you are bouncing off one another, learning lots of things from different perspectives. And so even after graduation, you do keep in contact, and we still text each other or send emails, and we still discuss some aspects of our clinical practice and look for, I suppose, insight on how other people might go about doing things. So that's probably, if I can encourage people to take up the challenge, it's certainly really rewarding. And I think both the practice that you become or you take up in adults also helps influence how you now treat the younger patient, as you see the other end of the oral spectrum. Perhaps the things that you might have done in that young child, what they might look like 40, 50 years down the track. And perhaps that might influence how you then choose to do some of the dentistry in those younger clients.
Now, if I'm correct, Tracy, you're also involved in supporting our program for our students as well, or is that?
Yes, I do some support. This semester I've been fortunate enough to work in the SIM clinic and meet some of the graduate students that are working currently, and they've been an interesting group of people. I've learnt lots from them. I hope they've learnt a little bit from me. I always think as a therapist you do have perhaps a little bit of a different way of thinking about things than perhaps other clinicians might. Maybe just the way that we've evolved our practice over the years, and we certainly do have a very preventive way of looking at dentistry, so we might not be, sometimes we're not the first people to pick up the drill and do the drill and fill, so we do look at things from perhaps a more medical model in some ways. And so I've enjoyed that time. I found the students seem to enjoy what we've been talking about. We certainly have done some interesting case studies, and every student will have an opinion that might be slightly different, bring something else to the discussion, which I've found really interesting. So as the person perhaps helping facilitate, I think I learn equally as much, because they've all come from various places and various practices and seen a lot of different dentistry over the years. So, yes.
Brilliant, thank you. And I think that really strikes a chord with one of the key messages that's been coming through today, is that this is a very collegiate profession and it's a very collegiate program. I mean, the small class size itself really does lend itself to building strong bonds between the people that stay together. And as you both have said, even though these students may end up working far apart, they still keep in touch and they work with each other and develop strong professional practice support networks with each other. And I think that's one of the beautiful things about this particular field, is that you have that ability to develop those strong relationships, and you get to use those skills on a daily basis as well when you're working with your clients. And that's a really unique thing to this particular profession. something that you don't see as often in various other fields. Thank you so much, both of you. So we do have a few questions coming up, but we've just got a couple more student testimonials just to put up while you do go in and type in some of those questions. So just remember, it's on the Q&A panel on the top left-hand side of the screen. We have had a few questions come through already, so if you do have anything else you'd like to add, please feel free to do so. But what we'll actually do is we'll start off with a question that looks like it's actually aimed at you, Jenny. So in terms of admission into the degree, the student is asking if they need to be attached to a clinic before they apply to study with us.
They do. They need to have their own clinic and their own clinic mentor where they're working and have access to patients. So we ask that they have 2 days a week during the 8 weeks that they're able to do that. So they need to have had that established clinical environment and agreement of a mentor to supervise them during that period.
Brilliant. And what sort of advice would you give to people who are looking at approaching someone to be their mentor figure? Is it just a very casual conversation, or do you recommend some sort of structured approach?
Yeah. It's important to really have a good discussion beforehand that might occur over a few different meetings. They need to understand what the scope is of this adult therapy role. There are some that have very good understanding of what that entails, but there are others that are less sure. So the conversation needs to be around what the program is and what the role will be at the end of that program, so that they understand that fully. It's then around what the commitments are of a clinical mentor, the time commitment, the commitment to the practice. So I think it does need a few discussions with the relevant people to really make sure that everyone understands the different roles and what the program is going to achieve for them and for their practice.
Beautiful, thank you. And we do have another question here, which is about the distance learning weeks. So you mentioned that students will have the opportunity to do that. They're wondering if they can actually still do work during those times as well.
So all of the students work during those distance learning weeks. The amount that they work varies. Some people come in as part-time anyway, so they just undertake that normal part-time work and do their study on the other days. Some will take a little bit of time to make sure that they've got adequate time to be able to complete their study. That might depend on their personal situation, whether they have children, whether they have other things that they do. Others are able to fit in their normal working and just then study at night or on the weekends.
Yeah, it's good that it has that level of flexibility as well, because as you said, it does mean that the students can base it on their own personal circumstances and still be able to maintain that source of income as well, which is really, really helpful. So Tracy, we have a question here for you. So having worked in the industry for a while, what do you think are some of the key differences between working with adults and children? So you did mention earlier that a lot of the skills you use are quite similar in some ways, but what are some of the really core differences to your approach?
I think probably that people are people. You tend to treat them as people. So the age does have a difference in what you see happening within the oral environment. The personalities and that side of thing doesn't really change. It's more about what sort of changes might happen in the oral environment as someone does age. So you do see a lot more things around tooth wear and root caries, which isn't something you see at all in a young patient. You see a lot of restorative work that is starting to break down after being in the mouth for a long time. So those sorts of issues are perhaps something that is more challenging than what you would have seen on a day-to-day basis as a therapist, but perhaps as a hygienist you might have seen quite regularly with an adult client from a hygiene perspective. So the restorative work is often more around things that may have failed and what needs to be replaced, and about how to get clients to manage their oral health independently as they age. So there are other things that happen. So they may lose some mobility, some dexterity. They may find that they're on a lot of medications that might change the oral environment. So those things are perhaps things you wouldn't see in the child patient. And I think that probably the key thing about working with adults is that you're working in a team environment. So although I might provide some of the oral care for the patient, I'll have some colleagues that do things for that patient that are of a more complex nature that are outside of my scope, but they're then freed up to do those more complex aspects. So we work as a team, and I found that really interesting. So I've got to witness some of those more complex things taking place and seeing the results of those.
Fantastic. And that taps in again to that sort of collegiate nature of the profession. And it's good as well that people can specialise in their particular area and then delegate tasks around based on people's areas of expertise, rather than being an all-rounder. You can really get that depth of knowledge and skill in your particular field. That's fantastic. So we've got another question for Jenny. So this is about the intensive courses at the start of the degree. The person is looking for a bit of an idea in terms of the time commitment for hours and days, number of days in a row.
So each of the face-to-face weeks are Monday to Friday, 9 o'clock to 4 o'clock at night. Excuse me. So we really pack in the face-to-face during those weeks. So we would expect during week 1, 2, 7 and 16 for people need to block off on Monday to Friday, 9 to 4.
Beautiful. That's good to know, actually, because that gives them the ability to tailor and take some time off to get the intensive studies. And it's a good way to kick off the degree as well. So I have another question for Tracy. So this one is about your experiences in your current role. Have you had any particular standout cases or particularly rewarding experiences that you've found?
I think probably the most rewarding experience is seeing an entire family. So mum, dad and the children. In the past, that hasn't been possible. So I've recently had a migrant family. They've got 6 children and 2 adults. So we're talking from very young to middle-aged adults. The majority of their treatment was able to be completed by myself. They didn't need to see others. And so in which case I could provide basically the care for the whole entire family. So that built a relationship, and they feel like they've met someone that's going to continue that practice for them. So I'm looking forward to seeing them over the years, seeing the children grow, seeing mum and dad become grandparents and all those sorts of things, which perhaps not necessarily seen in previous opportunities. So I think those are the things that really are rewarding about being in a situation where age is no longer the barrier to who you see.
Wonderful. That's a fantastic insight, and it's lovely to see you talking about it so passionately as well. I know that our, I suppose I should say, listeners can't actually see us right now due to technical difficulties, but she's looking very, very enthusiastic. So that's a good descriptor there. So we don't have any more questions coming in at the moment. So it looks like we may be finishing up a little bit early today. So I'll open up a question to both of you. If you were to speak to a prospective student about the possibility of undertaking this course, what would be the key advice you would give them, or perhaps some of the key benefits of doing the program that you would really want them to take home as a message?
The key message from my part is that it's really being able to take a lot of what they already do and enhance that on a slightly different age range of patients, and that it just, the program, the feedback we get is that they just feel completely stimulated with the learning, and it gives them a new lease of life on what they do. They hear different information either from other colleagues or from the academic staff, and they just feel completely invigorated in their learning.
I would probably build on what Jenny has said in that it is a new opportunity. It does breathe new life into your practice from the point of view of satisfaction. Perhaps if you've been working for a number of years in a clinical practice, it's just another aspect to who you are as a clinician and the people that you can help. And perhaps also, there are some other good benefits. As mentioned, there's often some monetary rewards involved, but I think the satisfaction and just the variety. So having that adult conversation is nice every once in a while as well. So go and do it. You won't regret it.